Welcome to the second part of Unit 3 in the MAP RIA manual. Today we're going to talk about medication outcomes. What happens or does not happen after you give a medication is known as a medication outcome. When a medication is given, it may cause any of the following outcomes: desired effect, no effect noted, or side effects. The desired effect is when the medication does exactly what it's supposed to do. The person experiences the expected results of that medication. For example, if Tylenol is administered for a headache and then the headache goes away, that is the desired effect. Dilantin is administered to control seizures and then the person is seizure-free. So that is the desired effect. If no effect is noted when a medication is taken for a specific reason and the symptoms continue, then there's no effect noted from the medication. This could occur for one of the following reasons: the body will not respond to the medication, and a different medication will need to be ordered. For example, erythromycin is ordered for an ear infection. The person's had ear pain and a temperature of 100.2. After taking the medication for 2 days, the person still has the same symptoms. Ear pain and a temperature of 100.2, there's no effect noted. So the person will continue to experience those symptoms. If a medication hasn't had enough time to work, for example, the person was started on a new antidepressant medication just a week ago, and the person's still experiencing symptoms of depression, some medications take a little bit longer to work than others, and in this case, several weeks may be necessary for the person's symptoms to improve. When a new medication is started, you should document what you observe, even when there are no effects noted. This will help the healthcare provider figure out if the medication is working as intended. The other thing that can happen is side effects. These are a result of a medication that are not wanted or not intended. They can happen if the desired effect is achieved. Sometimes they can be mild. They may be uncomfortable, and they are not usually severe enough for the healthcare provider to discontinue the medication. Some examples might be an antibiotic may cure an ear infection, but it also might cause some nausea along with it, or a cold medicine may reduce a cough and runny nose, but also can cause sleepiness. Side effects note from mild to severe. So if the side effect is more severe, it's called an adverse response to the medication. So adverse responses are definitely not what we want for any medication under any circumstances. This could be an allergic reaction. The body's immune system reacts to the medication as if it was a foreign substance, and the allergic reaction will start with a rash. The rash may start in one area of the body and then spread. An allergic reaction may happen even if the person has taken the medication before without any issue. An anaphylactic reaction is a very severe, very dangerous, and life-threatening allergic reaction. So it's not just an allergic reaction, it's a very severe, very dangerous, life-threatening allergic reaction. And this is usually comes on very quickly. The reaction requires immediate medical attention, such as calling 911. An anaphylactic reaction usually consists of difficulty breathing, rash, and a change in vital signs. A paradoxical reaction is when the person experiences the exact opposite of what the medication was intended to produce. So, for example, a medication that's ordered to help a person relax, and instead the person becomes restless. Or another example would be somebody starts a medication to help them to sleep at night, and then that medication has a paradoxical reaction and they stay up all night long without sleeping a wink. So that would be a paradoxical reaction. Toxicity is another adverse response, and this is when the medication can build up in the body and the body can't handle it anymore. This can be life-threatening. Toxicity is more common with certain medications than others. So, for example, even a very common medication such as Tylenol could become toxic. Many anti-seizure medications also can build up in the body and cause toxicity. Usually a person's blood will be monitored to make sure the medication level is not toxic. So medication interactions. A medication interaction is a mixing of different medications in the body. This can either cause an increase or decrease of the effects and or side effects of one or both medications. The more person a medication takes, the greater chance of having an interaction. Medications can also interact with dietary supplements, other substances, and also certain foods. Some examples of interactions would be if an antibiotic is taken with calcium, the calcium interacts with the antibiotic, decreasing the effects of the antibiotic. So this means that the person will not get the desired effect from the antibiotic, and the antibiotic may not work the way it's supposed to. Vitamin K, which is found in green leafy vegetables, interacts with warfarin sodium, which is also known as Coumadin, and it's a blood thinner. So if vitamin K is taken in larger amounts or every day, it can cause the Coumadin to not do, or the warfarin sodium to do what it's supposed to do. So then the blood will not be thinned. If a medication, more than one pain medication is taken at a time, they can interact. This can also increase the effects of the side effects of either pain medication. Some other things to keep in mind with medication administration is how alcohol, nicotine, and caffeine can interfere with medication. So all three, alcohol, nicotine, and caffeine, can interfere with the absorption of medication in the body. You must inform the healthcare provider if the person that you support uses any of these substances. So we're going to read the interaction section of the tramadol medication information sheet. Circle what could happen if tramadol is taken with an alcoholic drink. So we're going to read here. The tramadol is an analgesic used to treat moderate to severe pain or chronic pain. Brand name is tramadol is Conzip, Ribix, Izolt, Ultrium, and Zytram. Some of those I've never heard of. How to take. Oral tablets, take with or without food. If you miss a dose, take it as soon as possible unless it's 1 hour before the next dose. If so, skip the missed dose, never double up on dose. Side effects are vertigo, depression, seizures, headache, fatigue, hypotension, blurred vision, nasal congestion, nausea, anorexia, constipation, GI irritation, diarrhea, pruritus, and urinary retention. So interactions, tell your healthcare provider if, excuse me, of all the medications you're taking, do not use with St. John's wort. That is a dietary supplement. Some people use St. John's wort for depression or mood. So it's saying do not give tramadol along with St. John's wort. Using tramadol together with alcohol may increase the side effects such as dizziness, drowsiness, confusion, and difficulty concentrating. So those are the things that we would be circling as an interaction with alcohol. And overdose reaction, this is very common actually with medications that can increase serotonin syndrome, neuroleptic malignant syndrome, increased heart rate, sweating, dilated pupils, tremors, high blood pressure, hypothermia, headache, and confusion. Also note, some people have sensitivity to medication. Each person may respond differently to the same medication. However, one person responds to a medication may not be the same as somebody else. So there's several factors that can contribute to a person's sensitivity to a medication. These factors can include age, weight, gender, general health, medical history, level of physical activity, and use of other medications and dietary supplements. For example, a healthcare provider would not necessarily order the same medication or dose for a 100-pound woman as they would for a 275-pound man, or a healthy 25-year-old and a 85-year-old with many health issues. Medication information. You are responsible for learning about the medications that you're administering. You must also know the reason for administering. To monitor a person for effects of a medication, you must learn about the people you're supporting, including their medical conditions and their medications prescribed, read about each new medication before administering it, and know where to find or how to contact medication information resources. Medication resources can include, or information can include, the MAP consultant, the medication information sheet, which is what we just went over for tramadol in regards to the alcohol. And this can be supplied by the pharmacist, just like if you were to go to the local Walgreens or CVS, you would get a prescription along with the information sheet, which is a law that the pharmacy provides you with. And this is going to tell you all the potential side effects for that medication and how to take it. You can also receive information from a reputable online source or a drug reference book. You're going to ask your supervisor where these are found at your work location. They should be current, less than 2 years old, for a drug reference book, or current, less than 2 years old, for a medication information sheet for all prescribed medications. Typically, what we use is a drug book that's less than 2 years old. So most of the houses have the drug reference book readily available for all staff to read, as well as online resources such as drugs.com, which is another reputable source, or medline.com. So let's match the terms to the related examples. So for number 1, we see controlled medication, and we're going to read through these here to see what we're going to get for some answers here. Mild itching and rash after taking a new medication. So that's not it. A prescription is required to obtain it, but does not require counting, or is also a scheduled 6 medication. So that is the correct answer here. So that would be B. A medication sensitivity. We're going to look for a 100-pound person may become sleepy after receiving a normal dose of ibuprofen. Coumadin and aspirin taken together cause a person's gum to bleed. Medication is ordered to help calm a person instead. The person becomes restless. Must be counted every time the keys change hands. Now remember, we're looking for medication sensitivity. So I'm going to go with the person, a 100-pound person becomes very sleepy after receiving medication. We're going to now look for anaphylactic reaction. Now remember, this is a life-threatening, sudden onset allergic reaction. We do see 911 being called here. What do we have down here? Let's go with the 911. You're always going to call for anaphylactic reaction. No effect noted. So we're going to look for something. So Tylenol was taken for back pain, and the back pain goes away. Nope, that was a good effect. Okay, antibiotic is ordered for bronchitis, and after 2 days, the person is still coughing and has a fever. So that would be L. Dietary supplement. We're going to go with K, multivitamin. And it's dietary because multivitamins are in food. Paradoxical effect. This is the opposite effect than what we want. And we're going to go with E. Medication is ordered to help calm a person, but instead the person becomes restless. Countable medication. So this is when it needs to be counted at change of shift every time. So it's going to be F, must be counted every time the keys change hands. Toxicity. This is when the body stores up more medication than it can handle, so J. Side effect. So we're going to look for mild upset. So it's mild enough to keep taking, kind of part of the course with some antibiotics. Desired effect, I saw something about back pain going away, so that would be, yep, I. So that's the desired effect. You take Tylenol and the back pain goes away. Allergic reaction. So this is going to be more of a rash. Here it is, A, mild rash occurring after taking a medication. That always bears very close watching, though, because it could turn into an anaphylactic reaction. And medication interaction. So Coumadin and aspirin taken together cause a person's gums to bleed. That would be D, mild medication interaction. So let's review. A medication can change one or more ways the body works. Medications are known for their brand name and or their generic name. The categories of medications are controlled, which are scheduled, anything that's scheduled 6 or get to schedule 2. Countable controlled is specifically scheduled 2 through 5, meaning it needs to be counted. And over-the-counter, it's a medication that you can purchase over-the-counter, such as Tylenol or ibuprofen. Medication outcomes include desired effect, which is when it does what it's intended to do. No effect noted means nothing happens. It doesn't take care of that headache or backache, or if there are side effects. So somebody takes Benadryl for a rash and they end up getting very sleepy. Adverse responses are severe side effects. Medications and dietary supplements can interact with each other, such as alcohol, nicotine, caffeine, and certain foods. The interaction may increase or decrease the effect of the medication, dietary supplement, or both. The more medications and dietary supplements a person takes, the greater chance there are for an interaction. The healthcare provider order is required to administer all medications and dietary supplements. So you always must have a healthcare provider order for each and everything. So if that is a question on your exam, you need to know that that is always going to be one of the things that is needed to administer anything. For supplements as well that are over the counter. And additional training is required to administer over-the-counter medications and dietary supplements without a pharmacy label. So that pharmacy label is very important. We definitely always want a pharmacy label, even if it isn't over-the-counter. But should there be some kind of an emergency, we can train staff to get that additional training specific to that particular medication and that person. You're responsible for learning about the medications that you administer, and you are responsible to know the reason a medication is ordered. And that wraps up this unit. Thank you for joining me for Unit 3.